Strep throat and the common cold are two distinct illnesses caused by different types of microorganisms, with strep being a bacterial infection and the cold a viral ailment. Strep throat typically presents with a sudden onset of sore throat, pain when swallowing, and fever, whereas a common cold usually involves a runny or stuffy nose, sneezing, and a milder sore throat. While strep throat may also be accompanied by swollen lymph nodes and tonsils, white patches on the tonsils, and red spots on the roof of the mouth, a cold is more likely to cause coughing and a general feeling of tiredness without the intense throat pain characteristic of strep. Treatment for strep throat involves antibiotics to fight the bacterial infection, while the common cold typically requires only supportive care, such as rest, fluids, and over-the-counter remedies to alleviate symptoms. Risk factors for strep throat include being a child or in close contact with someone who has strep, while susceptibility to colds is generally increased by factors like weakened immunity, smoking, and exposure to cold weather. Here are detailed aspects of each disease, underlining their differences and how to discern one from the other. Causative agent, bacterial versus viral. When differentiating between strep throat and the common cold, the causative agent is crucial. Strep throat is caused by the bacterium Streptococcus pyogenes, leading to a sore, red throat with white patches, pain when swallowing, and often fever, without the common cold's cough or runny nose. On the other hand, the common cold usually stems from various viruses, predominantly rhinoviruses, and is characterized by a runny or stuffy nose, sneezing, mild throat irritation, and sometimes a mild fever, generally without the intense throat pain of strep. Knowing the cause informs treatment. Antibiotics can treat strep throat, while colds require supportive care, as they are viral. Symptom onset, rapid versus gradual. Strep throat caused by the bacterium Streptococcus pyogenes typically presents with a rapid onset of symptoms. Patients often experience a sudden sore throat, pain when swallowing, and fever without the common cold symptoms such as coughing or sneezing. On the other hand, a cold, usually triggered by a virus, develops gradually. Symptoms start with a tickle in the throat, progress to sneezing, a runny or stuffy nose, and a mild cough. The absence of a high fever and a more incremental increase in symptoms can help distinguish a cold from strep throat. Noting the speed and sequence of symptom emergence is crucial for healthcare providers to accurately diagnose and treat these conditions. Fever presentation, common versus rare. When distinguishing between strep throat and a common cold, fever is a key symptom. Strep throat often presents with a sudden high fever, signaling the body's response to the bacterial infection caused by Streptococcus pyogenes. On the other hand, a common cold, usually triggered by a virus, seldom causes a high fever. If a fever occurs with a cold, it tends to be mild. Consequently, the presence of a significant fever is a strong indicator pointing towards strep throat rather than a common cold, aiding healthcare providers in their diagnostic process and guiding appropriate treatment, as antibiotics may be necessary for strep but are ineffective against viral infections like the common cold. Treatment response, antibiotic efficacy versus symptomatic relief. When differentiating between strep throat, a bacterial infection, and the common cold, which is viral, one of the key factors is treatment response. Strep throat caused by the bacteria group A Streptococcus responds well to antibiotics, which can quickly eradicate the infection, reduce symptoms, and prevent complications. Conversely, the common cold, typically caused by rhinoviruses, does not have an effective antiviral treatment, and therefore management focuses on symptomatic relief. Decongestants, cough suppressants, and analgesics can ease symptoms, but unlike strep throat, the course of the cold must resolve as the immune system gradually overcomes the viral infection. Recognizing the difference can prevent unnecessary antibiotic use, which is ineffective against viruses and can contribute to antibiotic resistance. Contagious period, early infection versus throughout symptoms. When differentiating between strep throat and a common cold based on contagious periods, it's important to note stark differences in their infectious windows. Strep throat, caused by the Streptococcus pyogenes bacteria, becomes contagious early on, even before symptoms manifest, and can remain so until 24 hours after appropriate antibiotic treatment. In contrast, the common cold, typically triggered by rhinoviruses, has a broader contagious period starting a few days before symptom onset and persists as long as the symptoms are present. Understanding these nuances is crucial so that individuals can minimize the risk of transmission by adopting timely isolation measures and seeking prompt medical attention when necessary.